During the 19th and 20th centuries, science progressed in many fields. Scientists worked hard to make this progress by conducting various types of experiments. Most of these experiments were humane, but some of the experiments were brutal. Some experiments were conducted using live humans. Let's look at 10 weird and inhuman experiments in history. Number 10. Project MKUltra. This experiment was started in 1953 and officially halted in 1973. The project was designed and undertaken by the U.S. Central Intelligence Agency, also known as CIA. Therefore, this project, codenamed as CIA Mind Control Program. During this project, experiments on humans were conducted to test mind control mechanisms, remove old memories from brain, and also for psychological torture. CIA conducted these experiments by injecting a chemical known as LSD, which stands for lysergic acid diethylamide, which can make the mind severely distorted. Sometimes they mentally and physically tortured people, isolated them and tried to get into their head using hypnosis. Main goal of this experiment was to make an individual subservient to an imposed control to the point where he will perform acts against its own will and have no memory of the act. Number 9. Tuskegee Syphilis Study. This inhuman experiment conducted in the United States, Alabama, for a course of 40 years, starting from 1932 to 1972. Main goal of this experiment was to study and find a stable cure for the untreated syphilis disease, which is a sexually transmitted infection caused by a bacteria. They used African American men as their test subjects by telling them they were receiving free health care from the federal government of the United States. Initially, they decided to conduct the experiment only for 6 months, but it was extended to 40 years. After funding for treatment was lost, the study was continued without informing the men that they would never be treated. None of the infected men were treated with penicillin, despite the fact that by 1947, the antibiotic was widely available and had become the standard treatment for syphilis. Study continued until 1972, when a leak to the press resulted in its termination on November the 16th of that year. This experiment caused the deaths of 128 of its participants, either directly from syphilis or from related complications. Number 8. Hepatitis studies at Willowbrook State School. 70 years ago, a monstrous hepatitis experiment was performed on mentally disabled children at Willowbrook State School, situated on Staten Island in New York City. Medical studies were carried out there between the late 1950s and the 70s by medical researchers Saul Krugman and Robert W. McCollum. Goal of this experiment was to better understand the differences between serum hepatitis, which is spread by blood transfusions, from infectious hepatitis, which is spread directly from person to person. Dr. Maurice Hillman, vaccinologist by his profession, stated that the Willowbrook studies were the most unethical medical experiments ever performed on children in the United States. The experiment required deliberately infecting children with the disease. Offering one's child to the experiment was oftentimes the only way to guarantee admittance into this overcrowded institution. A public outcry forced the research project and medical studies to be discontinued. Number 7. Human radiation experiments at Washington and Oregon prisons. Between 1963 and 1973, prison inmates of Washington and Oregon prison were used as test subjects in an experiment designed to test the effects of radiation on testicles. Experiment was conducted by the University of Washington on behalf of the U.S. government. This experiment was conducted to help determine how much radiation U.S. astronauts could bear during space flights. 130 inmates willingly agreed to participate in the experiment as a result of cash bribing and suggestion of parole. Researchers deliberately exposed these test subjects to 400 rays of radiation in 10-minute intervals. This dose of radiation is stronger than 20 modern diagnostic X-rays would give. Today, some of the former inmates say they were unaware of the long-term risks of their agreement. Using an X-ray device, researchers beamed varying doses of radiation on the prisoners' testicles. An article published in a scientific journal by researchers who conducted the tests said some of the prisoners were exposed to much as 640 rays, a potentially fatal amount if spread over the whole body. The Washington state experiments were halted in 1970, and the Oregon experiments ended in 1973. Number 6. Syphilis experiments in Guatemala. From 1946 to 1948, the United States government, Guatemalan President Juan Bermejo, and some Guatemalan health ministries cooperated in a disturbing human experiment. This experiment was led by physician John Charles Cutler, who also participated in the late stages of the Tuskegee syphilis experiment. The goal of the Guatemala syphilis study was ultimately to determine the effectiveness of penicillin. Doctors infected soldiers, prostitutes, prisoners and mental patients with syphilis and other sexually transmitted diseases without the informed consent of the subjects. Treated only with antibiotics, the experiment resulted in at least 83 deaths. In 2010, the United States made a formal apology to Guatemala for the ethical violations that took place. Number 5. The Aversion Project. Aversion Project was a medical torture program in South Africa, led by Dr. Aubrey Levin. Goal of this experiment was to obtain more information about the treatment of homosexual military personnel during the apartheid era in South Africa. Scientists believed that homosexuality is a mental illness and it can be cured. Between 1971 and 1989, victims were submitted to chemical castration and electric shock treatment meant to cure them of their homosexuality. Victims with this proclaimed mental illness were treated significantly different than other members. During the course of the shock therapy, electrodes were strapped to a patient's upper arm with wires running to a dial calibrated from 1 to 10. Homosexual men were shown pictures of a naked man and encouraged to fantasize, at which point the patient was subjected to severe shocks. If the soldiers showed any form of sexual response, the voltage was increased throughout the treatment. The patient would then be shown a colored picture of a woman, which was supposed to stimulate arousal. However, more often than not, this failed. As a result of these failures, there is also evidence that sexual realignment procedures took place on the people who were unable to be cured. These therapies reached their peak during the 1970s, and the definition of homosexuals as mentally ill was removed from the American Psychiatric Association's manual in 1973, and the treatment was left behind. Dr. Aubrey Levin currently works at a teaching hospital in Canada. Number 4. Experiment on testicle transplants. Leo Stanley, the physician in charge at San Quentin prison in California, conducted one of the most disturbing experiments in human history. He surgically transplanted the testicles of executed criminals into living inmates. Reason behind this weird and disturbing experiment was Stanley felt that males who committed crimes shared a common characteristic: low testosterone levels, and raising it would reduce the crime rates. More than 600 inmates became the victim of Stanley's this crazy theory. When there was a shortage of human testicles, he went on to inject liquefied animal testicles into the prisoners. Number 3. Human experimentation in North Korea. Several North Korean defectors, including former prisoner Lee Soon-ok, have described witnessing disturbing cases of human experimentation. 50 healthy female prisoners were selected and given poisoned cabbage leaves. All of the women were required to eat the cabbage, despite cries of distress from those who had already eaten. All 50 died after 20 minutes of vomiting blood and anal bleeding. Refusing to eat the cabbage would allegedly have meant reprisals against them and their families. Other described experiments include the practice of surgery on prisoners without anesthesia, purposeful starvation, etc. It is said that each month, a black van known as the Crow collects 40 to 50 people from a camp and takes them to a known location for experiments. Number 2. Experiments on newborns. In the 1960s, researchers at the University of California began an experiment to study changes in blood pressure and blood flow. Experiment was conducted using 113 newborns, ranging in age from 1 hour to 3 days. Researchers inserted a catheter through the baby's umbilical arteries and into their aortas, and then submerged their feet in ice water for the purpose of testing aortic pressure. Another of the studies, they strapped 15 newborn babies to a circumcision board and turned them upside down so that all of their blood rushed into their heads in order to monitor the blood pressure. Number 1. Unit 731. Unit 731, also known as Detachment 731, was a covert biological and chemical warfare research and development unit of the Imperial Japanese Army that undertook lethal human experimentation during the Second Sino-Japanese War of World War II. Unit 731 was responsible for some of the most atrocious war crimes in history. Chinese and Russian men, women, children, infants, the elderly, and pregnant women were subjected to experiments which included the removal of organs from a live body, often without anesthesia. Some prisoners even had their stomachs surgically removed and the esophagus reattached to the intestines. Prisoners were injected with diseases, disguised as vaccinations, to study their effects. Female prisoners were forced to become pregnant for use in experiments. To study the effects of untreated venereal diseases, unit members orchestrated forced sex acts between infected and non-infected prisoners to transmit the disease, then studied. Prisoners were also repeatedly subject to rape by guards. In other tests, subjects were deprived of food and water to determine the length of time until death, placed into low-pressure chambers until their eyes popped from the sockets, injected with animal blood, exposed to lethal doses of X-rays, subjected to various chemical weapons inside gas chambers, crushed with heavy objects, injected with seawater, and burned or buried alive, and etc. Army engineer Hisato Yoshimura conducted an experiment known as frostbite testing, in which various appendages of humans were dipped in water and allowing the limb to freeze. Once frozen, they were struck with a short stick to test the pain arise in victim's body. During this experiment, most of the limbs were broken into pieces. This lethal human experiment was ended in year 1945.